So did someone plan that? Did someone say, let's make sure the students in Detroit don't go to college? Not necessarily. Given the resources they have, given the structure, given the situation, we know it's going to happen. And we know that almost all the students in Detroit Public School are students of color, primarily African American, and primarily low income. So, again, we call this opportunity structure, and I want to introduce one other concept, and that is systems thinking. So structural racialization is an example of a system. And the reason I introduced that idea of systems, that structures sometimes sound static. They're just there. But systems, we know, are dynamic. They're constantly shifting. And in a system, you're more concerned about relationships than about things. So you don't just look at schools. You look at schools in relationship to housing, in relationship to tax base, in relationship to transportation, in relationship to jobs. You have to look at all these things in relationship and the dynamism between these things. So in systems, we actually study relationships more than we study the things. And so I suggest that we actually start doing that. We just did a training for HUD, and we talked about, again, that the more factors you can look at in terms of communities and population, the more robust your understanding and the more stable and sustainable your goals. So if you just pick one thing, you actually are inclined to miss the mark. And let me just give you one example. And the Center for Disease Control has actually done this. If you just increase, and they did this in Massachusetts, if you just increase healthcare insurance for all folks in Massachusetts and nothing else, you actually will also increase the disparity between whites and blacks in terms of health outcomes. And that's somewhat counterintuitive, because the fact is that blacks are more likely not to have health insurance than whites. So why would increasing health insurance for everyone increase the disparities between blacks and whites? It's because you're looking at a system. The system is dynamic. And the problem is, blacks and whites are not situated the same. Yes, blacks don't have health insurance, but they also live in communities where they're less likely to be clinics, doctors, hospitals. This is not just true for blacks in Massachusetts. It's even more true when you look at rural areas. Rural areas are not likely to have healthcare facilities. So you give them a piece of paper and you say, now you have healthcare insurance. And what happens, and this is not simulation, this actually happened in Massachusetts, in the Center for Disease Control is concerned with happening across the country, is that a lot of doctors in rural areas and some of the doctors in the inner city would prefer to be someplace else. So you actually give health insurance, you create demand in attractive middle-class areas. So those doctors who were in those areas and not wanting to be there actually get pulled out of those areas. So now everybody has health insurance, but the people who were isolated by doctors and healthcare clinics are now even more isolated. So the problem facing most whites in terms of healthcare is lack of insurance, not lack of physical access. The problem facing blacks and Latinos and rural communities is lack of insurance and lack of access. So they're not situated the same. So if you look at one indicator, it looks like this program is really going to help blacks or rural people because they really need health insurance. But in fact, it actually hurts them. So it's really important from a system perspective that we look at a number of these things together and look at these things in relationship to each other. And from a structural system perspective, we are very much concerned about outcomes, not intentions. We're less concerned about who's to blame. And this is something we obsess about. So we have a global financial crisis. We lock up Madoff and stop making loans to the black community. Problem solved, mission accomplished. So, and I've been saying, we actually had a conference on this, and I've been saying it was a structural and systems problem. It can't be fixed just at the personal level. We, as a society, are so obsessed with everything being individual and personal. It's like, we're going to give black folks training in financial literacy. That's not the problem. It was a systemic problem across the country. In fact, if I can just digress for a minute, if you think about Goldman Sachs. Goldman Sachs was sued and recently settled with the federal government. Goldman Sachs, the secondary market, told banks, we like more subprime loans. Not prime loans. We want more subprime loans. Those loans disproportionately went to the black Latino community because we make more money off of them. So go out and originate more subprime loans. The banks did that. Goldman Sachs, they took those loans, they securitized them, and sold them to investors. And then Goldman Sachs bet that the loans would fail. So now we've got all these subprime loans bundled together, and we sold them to these investors on Wall Street who understand the financial system. But we, Goldman Sachs, have reason to believe these loans won't fail. If they fail, we get rich. You know what? They fail. Goldman Sachs got rich. The federal government sued Goldman Sachs, and Goldman Sachs settled. It sued, though, not on behalf of the black and Latino homeowners who took out those loans. It sued on behalf of the investors. Now, I feel sorry for these poor, actually they weren't poor, but these investors on Wall Street, but what about the homeowners? So what I'm suggesting is no one said, okay, the solution to this problem is we need to make sure the investors on Wall Street take a class in financial literacy. But when it came to the black and Latino community, that was the solution. You guys need to get smartened up. So often if we have structural problems or system problems, we think the solution is personal. If we have a school system that's failing, instead of fixing the school system, we want to fix the kid. So it actually calls us to look at problems from a different perspective. I don't know if I can get this to work, but it didn't work. Basically, what you see, if I could get this to work, is that unemployment has expanded over the entire country. So something's going on. It can't be explained by geography. It can't be explained by individuals. The country now is facing mass unemployment, which, of course, you know. And, of course, the government has played a role in all this. These are structures and their policies that support the structures. Some of the things that happen in terms of structures is that there's time lag. We do something today, and the effect of it is not fully felt for 20, 30, 40 years. So in the 1940s and 50s, we had redlining. In the 1990s and early this century, we had reverse redlining in the same communities. They're related, even though there's a 50-year lag. We know that putting children in highly segregated schools, segregated by class and income, depress the outcome of those children and actually cause them to lose IQ points. So, what do we need to do? We need to think in a new way, we need to talk in a new way, we need to act in a new way. We need to think about the racialized impact of structures. We need to move beyond just the narrative of personal responsibility. And we need to challenge assumptions and policies. In terms of talking about race, we need to talk about something I call target universalism, where we have universal goals for targeted strategies. The goal is to make sure everyone has health insurance. The strategy to get that will be different for black communities and rural communities. It's not a specialized program for blacks. It's a program to get everyone to have health care. What we do, including in Washington, we have universal strategies, and then it would create disparate outcomes. Universal goals, targeted strategies. We need to focus on the structures, not just the individual, And we need to focus on the 98%, not just 2%. What's going on in the unconscious? How are people hearing this? An interesting thing about this is you can't ask them. You can't ask them how you're hearing it because they don't know. But there are ways in which we can test this. And then we need to focus on relationship between groups and relationship between systems. We need to move beyond the disparity frame. And I can, if there's time, I can tell you we've had some fabulous success around the country in terms of doing this work in very concrete terms. So if you go back, and I'm about to end of my slides, if you go back to the beginning where I talked about structural racialization on one hand, implicit bias on the other, the third was power. You need power to make this happen. This is not just change the language, if we have good policy, it'll happen. This is going to be a fight, and those with power will have more influence than those without. And of course, that means organized. And that's one of the reasons I think what Arise is doing this sort of work. We need to strengthen engagement with communities. And again, recognize that there's up escalators, there's down escalators, but there are also people in wheelchairs who will need programs that neither of those approaches an escalator will solve. And if you want more information, you should take time to visit our website, where we have a lot of this stuff filled out, including practices in 30 or 40 different communities throughout the country. So I'll stop here and turn it back over to Ms. Anderson.